Patrick Commiskey in Albuquerque. I'm going to show a whole cataract surgery case. This is a mature brunescent cataract, meaning it is very dense and slightly swollen. The patient has both of his eyes looking like this. The patient can't see anything at all, just hand movements. The hand moving in front of you. That's all you can see. Both eyes. So the way I approach it is a little bit different, a little bit the same. So one consideration is if the cataract, is under pressure, like if the capsule is pressurized, and so I'll use some maneuvers to depressurize it. An issue is that the pupil is a little bit on the small side at the beginning of the case, and perhaps if this was a so-called normal cataract, I would have just gone ahead and made the capsule rexus with the pupil as it was. But seeing as this one's a bit of an advanced cataract, I wanted to make sure the pupil stayed nice and big for us. The patient, as you can see, is also moving around quite a bit. Now, this blue dye is meant to stain the capsule. So typically in cataract surgery, we rely on what we call the red reflex, which is the bounce back of the light that's shining into the eye off of the retina and then back at us. So using that red reflex, we can kind of tell, how deep we are and what the kind of structures of the lens might look like. But here we don't have that because the cataract is just white and opaque. So we use the blue dye there. I painted on the capsule um, so that the capsule is stained blue. So that'll help me um, going forward here. Now I'm using actually a needle, one of the rare times we use a needle. Don't worry, it doesn't hurt at all. So that needle there is just to make the initial opening in the capsule so that I can aspirate any of that swollen material that might be there. There really wasn't any of that, so this is just truly a brunescent cataract. If you can hear that beeping, it's my bread that's done in the oven. So I'll pause for a second, the audio. I'll get my bread out of the oven, and then we'll keep doing the cataract. And the bread looks wonderful. So does the other loaf. Okay, so that blue dye let us make a nice rexus or opening in the capsule. And then I used a little bit of liquid to separate the cataract material from that blue dye stained capsule. So we're going to go ahead with my usual technique, or the old cross chop. I like making a nice deep groove because it debulks the cataract material far away from the cornea, the clear shield on the front of the eye. And there's a nice promising crack to begin with. And then I'll kind of go about breaking the cataract up into little pieces. This one I spun all the way around 180 degrees to try to get a completed central crack, trying to deepen the groove a little bit more to get a good crack out of that. There is that good crack. You saw that reflex down at the bottom. So right here, there we go. Now once you get this first liberated piece, then you feel like, okay, we are making progress. So happy that we have a nice little piece of the pie or of a loaf of bread. Look, the cataract kind of looks like a loaf of bread a little bit. Looks like a kind of palish loaf of bread, but we're dividing that circular loaf into these quadrants so that we can remove it more efficiently. The CDE, which is a measurement of how much energy was used for this case, it's actually only 14. which is not too bad considering how dense of a cataract is. And I do like to use a lot of chopping maneuvers for denser cataracts because it decreases the overall amount of energy that's spent. I mean, at this point, I'm so happy. I know the patient's going to be so happy. Just relieved to have this doozy of a cataract out of there. And then that's the red reflex that I was talking about, where, the light goes into the eye, bounces back. I don't know if you can tell, but there's a little bit of cloudy material on the capsule, so I'm going to do a little bit of light polishing. Don't want to overdo it, always safety first, but I'm going ahead with a little bit of polishing. It's nice that the IA, irrigation aspiration tip that we use to do that polishing is very soft, so be able to kind of do some maneuvers there. And then here comes our lens. What an awesome thing. Now at this point, the patient already is remarking, I can actually see, I can see some shapes. So of course, what a wonderful thing it is to be a part of that. Here I'm removing that Malyugin ring that we used to um, keep the pupil open. Don't need that anymore. So that just gets removed. Easy peasy. And now we are in the home stretch, removing the viscoelastic. Now, got to visit with him afterward in the post-op area, and of course he's so happy. He's looking around. He's just so happy. Can't wait for his other eye to be done, and this is what it's all about. So, patient's so happy, the whole team's happy, and here we go. Thanks for watching.